Hello everyone and welcome to this audio podcast. This audio podcast as part of a Corpuscle Quake, as part of the Corpuscle Quake series or edition. Is audio podcast as part of a Quake and Storm. This audio podcast is part of a Bostix Quake, and this audio podcast as part of a Storm Robotics production. So in around sort of the prevalence of CKD and where the prevalence in this as part of this sort of overview or iteration will be sort of specific to the United Kingdom, although in other parts of the world the prevalence varies. The prevalence incidence and prevalence of CKD varies varies perhaps sort of more broadly owing to population variances. So the prevalence of proteinuria is also an issue in long-term management of recipients or patients with established chronic kidney disease or CKD, because it may also affect blood albumin creatinine ratio, and analysis of patients with unidentified CKD suggests the risk profile may be different to patients with identified CKD. Given that CKD affects all age groups, there is a significant variation in the management of CKD and in standards for prevention, early recognition, and intervention. Data emerging or have emerged point to the requirement or need for a global effort to improve CKD awareness and prevention to improve treatment and healthcare outcomes. Renal function is determined by the glomerular filtration rate (GFR) or EGFR and several reasons have been put forward to explain sort of the changes observed in the peer-reviewed works. Here there is an overview looking at the varying CKD stages and the link between the varying CKD stages and the severity in context in line to glomerular filtration rate and or EGFR, estimated glomerular filtration rate, and the five and sort of the sort of criteria in the adult population. Although in pediatrics and in young people, the EGFR and GFR, the variances are not so dissimilar. The measurement of prevalence of CKD in the United Kingdom is complicated, has been complicated by the fact that healthcare professionals in primary and secondary healthcare, so between healthcare sectors, employ different definitions around CKD stages based on EGFR, the estimated glomerular filtration rate, including either in around retrospectively around calculations around additional calculations, for example the MDRD or creatinine clearance, or in around creatinine clearance, and measurement using or utilizing creatinine clearance has significant practical problems and is known to be inaccurate. An alternative is to or has been to measure serum creatinine or SCR and or EGFR, estimated glomerular filtration rate, using an equation that corrects for some of the more significant non-renal influences. Some healthcare professionals take into account the patient's or recipient's general clinical history before progressing to measure renal insufficiency. Early laboratory analysis has a positive effect on referral rates in a large adult population, or in a large population. One investigation estimated the prevalence of patients who have significantly reduced glomerular filtration rate using a formula referred to as the Cockcroft-Gault formula. The Cockcroft-Gault or CG formula. The study included 2,781 outpatients referred to physicians to an urban laboratory network for serum creatinine measurement. Patients were grouped according to the concordance of serum creatinine level abnormalities, where, for example, abnormal would be more than 130 micromoles per liter, with significantly abnormal CG Cockcroft-Gault values, and sort of abnormal at the lower end being less than 50. Abnormal GFR or EGFR being less than 50 mil per min, and the CG value of less than 50 mil per min was selected to reflect the substantial renal impairment in all age groups. The investigation demonstrated that the prevalence of significantly abnormal renal function amongst patients identified by laboratories having normal range serum creatinine may help to facilitate the early identification of patients with renal impairment. Patients with elevated levels of urinary albumin are at increased risk of at an increased risk for renal replacement therapy and accelerated loss of renal function. Early detection of urine or urinary protein to slow progression of CKD and decrease mortality is not cost effective unless selectively directed toward high risk or suspect or high risk groups, i.e., for example, older persons and or persons with where amongst the evidence, one primary where patients or recipients may have one primary health condition or more, and at the same time where at the same time early detection of urine protein to slow progression of CKD and decrease mortality is not cost effective unless selectively directed towards high suspect or high risk groups, and all conducted or carried at an infrequent interval of in around 10 years. The GFR, by the way, as additional perspective or basis is the EGFR, GFR in patients or recipients do not change all that much in around between 5 and 10 years, in around 5 to 10 years. Point of care testing, however, POCT for albuminuria identifies patients at increased risk for progressive CKD, and 40 to 50% of whom were previously diagnosed or untreated. That draws this audio podcast to a close. This audio podcast as part of a Corpuscle Quake. This audio podcast as part of a Quake and Storm. this audio podcast as part of a Bostics Quake. This audio podcast as part of a Storm Lobostics production.